We want to keep looking for solutions to spark new ideas and get beyond the rhetoric. And one of them is, what if medical school was free? Did you know the average doctor comes out of school with more than $154,000 in debt, putting a lot of pressure on them to pay it back? The goal might be to get more doctors into the primary care system, reduce costs. The University of Central Florida in Orlando is giving that model a try. Can it work? Dr. Deborah German is Dean of UCF's College of Medicine and he is here, along with NBC News Chief Medical Editor and host of Dr. Nancy on MSNBC, Dr. Nancy Snyderman. So thrilled to have both of you here to talk about this. Dr. German, let me start with you. And we, by the way, did share with our viewers that your school was the hardest to get into this year, partially because you were giving people this opportunity for free. How does it work?
Well, we admitted 41 students. This is our charter class. This is the first class to be admitted to the University of Central Florida College of Medicine. And we secured donors for each student so that each student will have tuition and living expenses paid for all 4 years.
And does this have any strings attached, as in when they are done, do they have to work for an affiliated hospital, or are they going to go through the regular residency system?
No, we have no strings attached to this opportunity.
Dr. Nancy, is this something that might work, that we could do more broadly?
Oh, Erin, I think it's a novel idea and something that a lot of people are watching. And I think there are two ways you can sort of structure it, just like Deborah's program has, or a place where perhaps you come and you get your tuition free, but then you have to give back, sort of like the public health corps, where you really donate your time, perhaps to a rural or an inner city program. But if we're really going to step up to the plate and talk about reshifting and reallocating health care dollars and putting physicians where they're needed, we're going to have to help these young people get out of medical school without being burdened for 5 or 10 years with this huge, huge debt.
And Dr. Nancy, do you think this, Jim Cramer was being somewhat facetious before the commercial. He said, oh, maybe we wouldn't have so many plastic surgeons. But he sort of got at a real point, right, which is that people end up having to choose these specialties where they can be paid a lot rather than things like primary care?
Yeah, I think we're looking at a couple of things. One is most physicians go into medicine for all the right reasons and not because they expect to become wealthy at the end.
Right.
But the reality is, if you're a plastic surgeon, you can charge a fee for service, and there are no insurance middlemen. It's a very lucrative way. Some dermatology, plastic surgery, so they sort of scooted to the outside. But that's really a small percentage of physicians who want to grow up to be primary care doctors or surgeons. I think the more intellectual conversation is how do you keep up? What does primary care look like in this increasingly complicated medical landscape? And how do you still reward innovation, surgical subspecialties? And I think that's a conversation that, frankly, we really haven't had.
Dr. German, who are these donors? And are you confident they're going to be, have they committed for the entire length of time? Is this something you're going to be able to keep doing?
Well, these donors are committed to the charter class, and they will be giving for the 4 years that these students are in medical school. And yes, they are committed, and they are everyone. We have hospitals, banks, law firms, businesses, ladies groups, you name it, we have it. Everyone wanted to make our medical school a success and contribute to this. And I'd like to pick up on something that Dr. Snyderman said. She said, and I believe this is the core of what has made us successful, when medical students come to medical school, they come with dreams and they come with altruism. And they want the world to be a better place. Many of them are interested in primary care, and many of them are interested in specialties. And what happens is the realities of their lives kick in somewhere around the 4th year of medical school, because they're at the age where they're marrying, they're having children, and they graduate with debts sometimes in excess of $200,000. And then they've got internships and residencies to do, which are not high-paying jobs. And if you think about it, when you're at that point in your career where you have to make a career decision and you've got a family that's depending on you and a big debt, it's very hard to follow your heart. And I think our students will be able to do that.
Well, Dr. Nancy, how can we scale this up? It's inspiring to hear about something where so many donors got involved. But on a broader basis, as far as a country, is it something that should be part of the debate right now about health care reform as to some sort of, and I know even using the word government funded may worry people, to make this work across the system, that maybe that's where we put the public dollars?
You're looking at a couple of different models. Deborah's program, one where you have, obviously, donors like Cleveland Clinic, where they really turned to their foundation. The concern is, as the markets have taken a hit, a lot of the philanthropy associated with medical schools has also taken a hit. So I think you've seen medical schools sort of step back from that sort of free ride model. And then the other question is, should the federal government really say we're going to invest in the future of healthcare in this country, and this is what investment looks like? There are several models. I think there are pros and cons with all of them. But if we're really going to, and I mean really going to talk about changing the landscape, we have to talk about dealing with the indebtedness.
All right. Well, thank you very much, Dr. Nancy Snyderman, Dr. Deborah German. Appreciate both of you being with us. And, of course, we'll continue to cover this story. And for all of you, you can see Dr. Nancy every day on her show, Dr. Nancy, on MSNBC at noon Eastern. All right. Up next, we're going to get the latest on today's stock.